have burning questions on egg freezing? Check out the Preserve Your Fertility series by SMG Women's Health.
There is a list of frequently asked questions about egg freezing, and I will be guessing whether they are true or false. Here we have Dr. Anupriya Agarwal as well as Dr. Lim Min Yu, and together we will discover fascinating facts about egg freezing in Singapore. I'm ready. Are you ready?
Let's go.
If I freeze my eggs at the age of 30 years versus I freeze my eggs at the age of 40 years, will it be the same results?
No, I don't think so. So my answer is false. Because I feel that, at age 30, I'm still young, I'm still vibrant, my body's still healthy. As compared to when I'm 40, maybe I'm starting to move into menopause.
When you're 30 or 25, your skin is much better than when you are 40 years old. Aging affects all parts of the body. It affects the skin, it affects the eggs as well. So the quality of the eggs that we get at age 30 versus the quality of the eggs that we get at age 40 are very, very different. Not only that, as we grow older, our ovaries, they are using up these eggs to give us the menstrual cycle. So as we age, the quantity of the eggs inside the ovaries also reduce. So both ways, quantity as well as quality of the eggs do deteriorate as we age.
I mean, this is my call. It's my call and my cue to get it done ASAP while I'm still in my 30s, because then I'll get a bountiful harvest, that's right?
Absolutely, of good quality.
Of good quality, yeah, that's right.
So, something I get asked quite often, a natural and genuine concern, doing egg freezing will make me reach my menopause sooner.
Actually, that's a very valid question. Because I feel like, I don't know, you're retrieving all those eggs. Are you stopping menstruation? I don't know. It's false?
It is indeed false.
Yeah.
In the natural cycle, without any external hormones, only one follicle goes on to dominate, and then only one egg is released during the process of ovulation. In IVF and egg freezing, that is, we give these hormone medicines, and they actually help the other follicles which also start the process to develop and grow, so that when it comes to the trigger and egg collection, we are actually just trying to get the other follicles, which would otherwise have just fallen by the wayside, to actually get to maturity. So doing stimulation for egg freezing and subsequently for IVF doesn't really make you reach menopause any sooner.
Does egg freezing entail a long downtime?
I would think the answer is no, but no means false, I suppose.
People have this myth that this is a very complicated process. IVF clinicians, we understand that women who are undergoing IVF are also career women, who are undergoing social egg freezing, they are also career women. Most of the ultrasound scans, and she requires about 3 or 4 of them, are usually done either early in the morning before they start work, during the middle of the day when they are less busy. The only time that they require to take a day off actually is on the day that they have to undergo the egg collection procedure, because they will have to undergo anesthesia for that.
So how long does it take, to extract the eggs, like in that session?
So that's where I come to my next question.
Oh, okay.
It typically takes about 2 weeks of hormone injections for the woman, during this process of egg freezing. True or false?
Wow. Normally it takes two weeks, is it? Did you say 2 weeks?
2 weeks.
I suppose the answer is true.
Correct.
Yay!
Usually, we start injections when a lady starts having her period on around about day 1 or day 2. We'll start off with a dose of medication, and usually after about 4 days, she'll come back for further ultrasound scan and blood tests to monitor how her body is responding to those injections. The aim is not to just get one egg, but as many eggs as possible. And so we look on ultrasound scan for the follicles developing on the ovary.
Oh wow, I really learned a lot. So what about the next step?
So the next step is egg collection, or egg retrieval as we call it. What do you think, Roanna? Is this process of egg collection painful?
I guess it involves a lot of needles. I would like to say it's painful, but I'm hoping that it's not. So I would say false, it's not painful. Please enlighten me.
You're absolutely right. So the process actually involves putting in a probe, an ultrasound probe through the woman's vagina. I mean, imagine a needle going through the vagina. It does sound painful. It is painful. But that is the reason why we do this procedure under anesthesia.
Right.
So the woman is totally asleep. We do this procedure, we get all these eggs out. After she's awake, she will feel a bit sore in the lower belly. And the next day onwards, she feels perfectly fine.
That sounds promising because I get to enjoy my beauty sleep while
Yes.
the doctor helps me to, extract the eggs and freeze them for me. So, sounds good.
So the eggs need to be taken out of the freezer, and then sperm is used to fertilize those eggs, and the embryos are then replaced into the woman's uterus. What do you think?
I passed my science class, excelled in biology, so the answer is true.
Full marks. So clearly, when the eggs have been frozen, we do need to use an IVF process or in vitro fertilization process. So yes, they need to come out of the freezer and get warmed up. Most of the time, the sperm being used to fertilize the egg will actually be directly injected into the egg using a technique called intracytoplasmic sperm injection.
Oh.
After the eggs have successfully fertilized, they are called embryos. We normally try to monitor their growth and development for preferably 5 days until these embryos have reached the stage of something known as a blastocyst. Then it is blastocysts that will be transferred into the woman's uterus, and hopefully a positive pregnancy test will result approximately 2 weeks after that process.
By the end of this session, I would have learned a lot about egg freezing, and I'm gonna be an expert advocate now. Now you know egg freezing is a viable option. Will you opt for it? Thank you, Dr. Anu and Dr. Lim. This Preserve Your Fertility video series is just a start. Stay tuned for more videos from SMG Women's Health. See ya!